The treatment of shingles should be approached very seriously and comprehensively because it is a very painful condition. The processes involved are quite extensive, so comprehensive treatment is prescribed, antiviral, immunomodulating and sedative medications, and sometimes even immunosuppressants or simply antidepressants. Additionally, antihistamines are also added in this situation. As for antiviral medications, the main antivirals are acyclovir, Zovirax, valacyclovir, acyclovir, and famciclovir. They are prescribed both in tablet form and intravenously. In severe cases, acyclovir or Zovirax is administered intravenously because there are situations where the pain is simply unbearable and the rashes are very extensive. Ibuprofen is prescribed to relieve pain. But if the pain is very acute, then analgin with diphenhydramine is used. This is an old but proven medication. It is injected once or for 2 consecutive days, once a day for 2 days, at most 3, but usually a single injection is sufficient. Now, regarding antidepressants, yes, for this matter, you definitely need to consult a neurologist directly because there are many, a large number of antidepressants. The neurologist will select the appropriate medication. As for dermatological medications, again, these include Neuracal and Neurovitan. These are the main medications. As for antihistamines, these include the injectable forms of Suprastin and Tavegil, which are used to quickly relieve itching and the histamine reaction, essentially to break this chain. It is recommended in cases of such swelling and pronounced hyperemia to administer calcium gluconate intravenously or intramuscularly for 7 to 10 days. It works very well. As for, you see situations such as, for example, antiviral vaccination, right? After treatment, in order to prevent recurrence, because sometimes if shingles is not properly treated, there can be episodes of it reappearing. Therefore, to prevent these, it is necessary to undergo a more serious course of therapy or to receive an antiherpetic vaccine according to the prescribed schedule. But humanity is working on this. Also, regarding new medications, but I want to share a sort of story about how shingles, in fact, was already known back in ancient times. It was discovered, and there were already assumptions about the connection between chickenpox and herpes zoster as early as 1888, as suggested by Janos Bokai. But you know how it was? It was just a hypothesis. Then they started to observe, to study, and eventually confirmed that it was indeed true. There is a connection. In the 1950s, Thomas Weller was able to successfully isolate a separate strain of the virus specifically for herpes zoster. And as for the restored authors, later modernized this work. In 1974, Takahashi obtained a strain called the Oka strain, a wild-type virus. In other words, he isolated this particular strain, and it was only in 1980 in the United States that Anne Gershon began to specifically study the nature of all this, searching for a vaccine and working on its development. So she created it. And only Varivax, the vaccine developed specifically to protect against chickenpox, a common childhood illness, was officially approved for use in the United States in 1995. So you can see how long this whole process took. It took her 15 years for it to be approved and, well, for it to become part of life and help people.